Dale. All right, friends, and we are back. Thank you for joining us for another segment with us as we do this GLAAD takeover. My name is Gabriela again. I'm the executive director of Q Latinx, and I'm excited to be joined by Giselle Hernandez, that works with the Department of Health as a sexual minority coordinator. Giselle, please.
Hi, Gabriela. It's nice to meet you. It's nice to join you here tonight. Her and I actually know each other very well. I don't know why I said that. Um, we've worked together, especially with the HIV Latinx Task Force, to really get out there, especially in our Latino community, and get the message out there for people to get tested and to prevent as well. You know, what prevention methods are out there that they could take advantage of and resources.
So, and I definitely think we have like a very community-based approach, like whether it's tabling or going out into the community and handing out flyers. I think we've done a really good job at collaborating with different organizations to be able to support that message. And that's whether it be on social media or if it's us, like I mentioned, being there in person when it comes to our community, because I think the delivering messages is important to have different modes because people respond differently, right?
Exactly. Yeah, and we definitely need to meet people where they are. We need to go to where our community is gathering, especially the communities that we're trying to reach. So, in our Latino community, as we know, the numbers have gone up. As the population has grown in Central Florida and Orange County, unfortunately, that also has meant that the numbers of individuals that have been diagnosed with HIV has also gone up. So we need to make sure that we get the message out there to our Latino community that, you know, it's still there, HIV is still there, it's still in our community, and we need to protect ourselves and we need to test ourselves.
So, and in the language that we speak, I think that's also something that's very vital. Like, are
Exactly.
we speaking to our community? And also understanding that cuando estamos hablando español, like that there's a variety of dialects and what that means for our community. So if we don't speak that dialect, making sure that we're making those connections with other communities, including our indigenous community.
Exactly. Because and like you said, it's all about language, and we depending on where you come from, it really does depend the language you speak. I'm from Mexico. And I can tell you that even in Mexico, there are different parts of Mexico where they speak a little bit of a different dialect, or things may mean differently. And then when you come here, I know I had that when I came here, there were some words that either meant something different to me, sometimes even something that in my language might have been offensive, or I said something that to someone else was offensive. So definitely language plays a big part because we want to make sure that when we're giving out messages, that they're understanding what we're saying, right? That it doesn't mean something else to them. Sometimes even when people are speaking the same language, you have to make sure that the message that you're trying to portray is what's being understood by the person that's receiving it.
Yes, so, and I think it's also about delivery. I know before this conversation, I was like, I wish we would have recorded what we said beforehand, but we were having an amazing conversation. And I think it's also about talking about the delivery. So I'll do a really small account. I usually work within the LGBT community with sexual health and awareness and like sexual positivity. And so I kind of stay within that silo. And what again, I realized that we need to branch out. We need to be having these conversations within all our communities. With that being said, the LGBT community, as far as like condoms and lube, we're just very liberal with it. So like we're used to throwing it at pride parades and stuff like that. And I was invited to a Hispanic Latinx event to table. And of course, I had like my big bucket of condoms, and I'm like, pero espérate, what, why isn't anybody approaching my table? Like, and like I had to really have like that deep conversation with myself. And I talked to some others, and they're like, espérate, pero like realize that within the Latinx community. And I had to think back, and I'm like, espérate, I was raised religious. Like, why didn't I think of that? Like, right. Condoms aren't just thrown out everywhere. So like delivery of your message. So having them in discreet bags because, right, we're just not going to have condoms laid out. And like that could really mean even safety within our communities, um, especially for our women, and being
Well,
able to uplift that message of sexual health and positivity and awareness.
yeah, well, and like you said, especially for women that grew up in our Hispanic communities, right? Eso era cosa del hombre, right? Era la responsabilidad del hombre.
Y eso no, si
Y
no, tú eres qué. Hmm.
ujú, exactly, ¿verdad? Entonces esa es la responsabilidad del hombre y eso solamente es algo entre el marido y la mujer,
And
right?
then throw in being LGBTQ on top of that, and that's a whole nother wrap. So
Exactly.
yeah, I think again, like going back to that conversation, it's so important to uplift on an intergenerational space. Like we need to be talking to abuela, we need to be talking to titi, we need to be talking to our uncles, we need to be talking to everybody because at the end of the day, if we're having sex or if we're not having sex, we know somebody, and being able to spread that message of prevention is so important, as well as linkage to care and knowing where to go and building those bonds and those trusts. And I think one thing that we really do well within our communities is being able to engage in community and build that trust up. I know as myself, even though I'm an executive director, I work as a case manager, and my biggest thing is meeting people where they're at, like you had mentioned earlier, because again, that's how we are going to get that message across, and it's building that trust, and within building that trust is how we can create the awareness and the education components, and we can have those very personal conversations. Because I think when someone comes and gets tested, as personable as that is, we're not really having that in-depth conversation. So we really want to make sure that we're engaging within those 15 minutes or within whatever that testing time is, so that we can really capture that person as far as like educating, because that may have been their first conversation, right?
Right. No, and it's about making them comfortable too, you know, going back to like you said, when you were tabling and having those condoms. Maybe someone would have felt more comfortable approaching it if they were in those brown bags. So then there are times where if you have condoms that are placed discreetly in a brown bag, that people may feel more comfortable grabbing that little pack and putting it in their purse or putting it in their pocket, putting it away. So sometimes we do have to be self aware of where we are. Like they say, reading the room. You
Yes.
know, we need to be mindful of where we're going. That way we can reach out to the community. And like you said, meet them where they are. You know, the same thing goes with testing options. You know, people can get tested at many of the local organizations we have, but there's different options. If you feel more comfortable going to your provider and getting tested, you know, it is routine testing. So your provider should have, your primary care provider should have absolutely no issue having that testing done for you. It's routine care now. But if you're not that comfortable, or if you don't have a private provider, if you're underinsured, there are agencies. And then if you're someone that you really don't want to go into an agency, they even provide home testing kits now that can be sent to your home, you know, and it'll be in a confidential package. That way you can do it at your home. Resources are sent with those home testing kits. That way people could do it where they're comfortable in their home. But of course, they are provided with those resources so that they can go ahead and reach out when they're comfortable and when they need to. Hopefully, most of them will reach out, but at least it's done in their comfort, and at least that resource is available for them. I know that we offer that service here through Talk, Test, Treat, CFL. Um, but if you go to greaterthan.org, they can also show you where in other states people can have availability to those resources.
Okay, so do we know if Greater Than actually does provide linkage to care as well?
I believe they do. I believe they even have prep services available.
That's
Because I know if you go to their website, I don't know if it's kind of hard for you guys to see, but they do offer test, prep, treat.
Right.
Like I said, really depends on your state. You know, it's in alphabetical order. So you see California, Colorado,
Awesome.
Delaware, and of course, if you see Central Florida, there we are, top.
Yes.
So for those that are listening nationally, go to wearegreaterthan.org and look for your state. And then they'll show you the options you have as far as testing goes.
And we'll make sure to have it in the description for those that are listening as well. So just copy and paste. And definitely, if you need any support, reach out to the team. We'll be more than willing to answer any questions, listen. We do a very good job at, I think, being able to deliver that message on different platforms, I think is definitely important. How do you think as a collective we can continue spreading this message? Like,
Well, I think as
what
a
does that look like?
collective, our voices together are stronger than one, right?
Okay, so
But it makes a difference when you see that it's multiple people that are sharing the same message. You know, if you hear somebody share a message and then you hear somebody else sharing that same message, you're going to think to yourself, wait a minute, this is important, right? This is happening. I'm seeing that there's multiple people that are talking about this issue at hand. So therefore, this is something that's important. You know, just to put it in perspective, let's just say that if you went to the grocery store and you overheard a conversation where they were talking about there's a storm coming, there's weather coming, right? And then you go to work and you overhear a couple of coworkers talking about how there's a storm coming. What are you going to say to yourself? Wait a minute, there's something coming. I need to prepare. Well, it's the same thing, right? We have this issue with HIV, right? And people need to prepare for it. How do you prepare for it? Prevention. And let's talk about it. Inform yourself, educate yourself.
okay, so and I think being able to do it on a community level, to be able to provide that information and that access to individuals, to be able to feel comfortable to ask those questions. Because at the end of the day, like you mentioned, the more that we talk about it, we're going to normalize the conversation so that they're like, oh, wow, I saw that billboard and they were talking about HIV getting tested. And I also heard the radio. And I also heard my coworker mention, right, that they went out last night and then they all went and got tested. So like making sure that we're repeating that conversation and planting that seed, I think is important. And as we uplift each other, we find more voices in community that are willing to talk, right?
Exactly. And the more we all talk together and collaborate, there may not be certain people in the community that I may not be able to reach. I am lucky that I speak two languages, right? So I can reach out to people in the English language and in my native Spanish language, right? But how do how am I able to reach out to maybe those individuals that only speak Creole, right? Because our Creole population, for example, is growing, right? Well, if I make a connection, if I collaborate with maybe another agency that has someone that speaks Creole, then I can connect to that community as well,
Okay, so
right?
and you work as a system of care, like going back to like that direct service, like we need to be able to plug in Yuselas and Gabis in certain places to be like, oh man, well, I mean, I have the answer, but you know what, we're gonna figure it out and we'll find out because there's someone else that may.
Or may have the resources available to be able to help that person out, right?
So, and within that, people are more willing to reach out and again, go back to ask those questions and feel comfortable. So, Dale, what do you think that we can do here locally, or what do you think we're already doing? So, we mentioned the task force that we currently have in partnership with Department of Health that's led by Carlito, um, that spoke with us earlier and will be coming back a little bit earlier later on in the conversation. Um, and that task force is really about, again, uplifting the need to address the needs within the Latinx community when it comes to HIV prevention and linkage to care. So it's addressing those cultural barriers that we have. And then we also have our healthy sexual, which is a conversation that talks within community about like sex one-on-one.
Mhm.
um But what are some other ways that we think we can engage? I know that we were talking earlier about planning council
Mhm.
and the impact that we're having there.
Yeah, because like we said, we know we all need to come together and make sure that people know that these services are available. Like you said, the Latinx HIV task force, right?
Mhm.
Well, we know some of the barriers that exist in the Latinx community, right? Like people need to be aware that we don't care about your immigration status. That does not matter, right?
And the
You can
safety
still
in that, right?
and you can still receive services. And I think people may not realize, but that's a barrier. And it people feel more comfortable and are more apt to look for resources and care if they realize that their immigration status does not matter,
Okay, so
right? So I think is impactful, but we also need to come together and, like I said, see how we can reach out to other communities and even in our Latinx community so that they are aware. We need to meet them where they are and collaborate with other agencies. That way they can come together with us and help us become a stronger voice.
eso. I definitely agree. And I think the Planning Council has done a great job at being able to have that impact within providers and community. But I think it's definitely important to continue those conversations, right? Because at the end of the day, there's still those barriers and stigmas that still exist and prevent our community from being able to come together and have those conversations. But know that there is an open, loving community that is willing to, again, address these questions and be able to figure out the transportation piece, support with trying to navigate these different things as we're having these conversations. Because the more that we talk about our stories and the impact, I think, again, going back to what you mentioned earlier, is we're normalizing these conversations and we're inviting people in that are affected with, living with, affected by, at risk
Exactly.
of HIV. And we're normalizing it within everyone. And we're stopping the stigmas of, oh, you can catch it on a toilet seat, or oh no, we're addressing it, we're stopping it right there, and we're saying no, this is not it, and we need to join together, not
Exactly.
siloed, to address this situation, and this is how we end it.
Not only that, but too, like when you said the planning council, right? At the planning council, individuals have the opportunity to have their voice heard,
Eso.
right? To have the people that need that voice be heard, right? They're there to listen. And I think that's a great piece because, yes, we want to educate. Yes, we want people to hear our voices, but we also need to hear the community's voices, right?
Eso.
We also need to hear the consumers so that we know to meet them where they are. How can you meet people where they are if you're not listening to them? If you don't know what
Say that
matters,
one more time for the back.
right? And I think that's where the planning council comes in, is because it gives them that safe space, that opportunity for them to say, this is what matters to me,
Eso.
right? This is what the people that have a stakeholder in this can do for us to make this better for us, right? So that we are able to break down the barriers, right? And either stay in care or, you know, get the resources that we need, that people need in order to be able to prevent,
Mhm.
right? And know where.
To go, yes, and feel, again, go back to that safety piece and feel safe in asking these questions and know that no one is going to retaliate or know that no one's going to look up, frown or upon them. And I think that's again another piece of making sure that you're coming with full love, like, because I think sometimes people are like, oh, are they looking at me this way? They no, we're all here. HIV es otra cosa. That's it. Just
Exactly.
another thing in your healthcare.
Exactly. And that's exactly what we need to break down, right? It's the stigma, right? Tenemos que romper esas barreras
Eso.
para poder terminar con el estigma,
Yes.
right?
that piece.
Because I think it just makes you wonder how many people shy away from it, right? Because they don't want to be stigmatized, right? But we need to normalize the conversations that we're having,
Eso.
you know? And it's not just HIV, it's with STD prevention, it's with sexual health, period.
And I would even go just a little bit further on that because I was actually talking to someone this early and I was like, we all need to be talking about health in general. As Latinx individuals, we are the highest for heart disease and stroke. I was reading that the other day, and diabetes. And I was like, wow. And I sit here and think, and I remember my grandmother taking insulin, and I'm like, I don't ever remember having a conversation surrounding it. But like growing up, I'm just like, wow, like we are affected by so many other like comorbidities that we need to continue these conversations on all different levels, because I also think that medical mistrust that exists, like
Definitely.
Vix will fix it, right? Vix will fix it, you'll be fine, vete pa dormir,
Y
siete
ya.
jarabe, and you'll wake up just fine. And very laborious work, so it wasn't like you had time to rest. It was like, no, you're not behind a computer, no, you're doing laborious work and you're attempting to continue with your health while your arm is like falling off the side, and you're like, no, I'm good, because again, at the end of the day, we had to put food on the table. There really wasn't an option to go
Exactly.
to the doctor or to go to
There
these
were
things.
other things that were more important.
I was telling, I'm always telling someone something, but I was telling someone the other day, I was like, I got health insurance literally like 2 or 3 years ago. And I was like, Mira, just check me out, everything. And people were like, are you okay? And I was like, Mira, like access is like, sometimes we don't know what we don't know, right? Like, and
Exactly.
access can be so important for individuals, and just to not be uninsured and to try to figure out what that looks like, it so deters individuals trying to figure out sometime the system and how it works, regardless of all these amazing programs that sometimes we have. It's important for us to be, like I said, on that ground level, on the social media level, wherever people are, we need to be there, because the delivery of what that looks like is so crucial for community.
It is, and they need to know that the services are out there, right? But I think a lot of times too, and I know this is very true of the Latino community, is we don't let the conversation grow.
Ooh,
We don't
yep.
let the conversation grow. Like we say to ourselves when we talk to our children and when we're trying to educate with our children, well, what are we educating them on when it
Mm.
comes to sexual health, right? When they're young, we tell them no one should see you sin ropa and no one should touch you inappropriately. And if they do, or if somebody looks at you, you need to tell me right away. But as our children grow, does the conversation grow?
Or we give candy this, or we give candy names to our private parts, and then there's like no separation of what that means, and we're like, oh, is that a good thing, is that a bad thing? Or sometimes the conversation is non-existent at all, and it's like a
Exactly.
lot of us grow up with these situations and these conversations that never had have happened, and then we go off and we're 21 and we're 22 and we're 23 or whatever age we are, and then it's like, oh, okay, it's an after conversation. So the importance of that prevention piece, to be having those conversations with our middle schoolers, to be having those conversations with our parents and caregivers. That's a whole nother community that sometimes we leave out of the conversation. How are we providing tools for our caregivers and our parents on all different levels, understanding that they're still right, those stigmas and barriers that may have existed within our older community. So making sure that we're also speaking to them, and maybe not, again, like throwing the condom at them, but saying, okay, these are the conversation points. And maybe you can reference the website, or you can reference X, Y, and Z, or contact this person to ask X, Y, and Z questions.
Exactly. And find out what works for you, right? What prevention methods work for you, right? Whether it's a male condom, an internal condom, right? Or PrEP, right? Finding out what works for you. And also for like our Latino women, I mean, when we were at Pride of Color, I had a conversation with someone that was probably in their 40s, early 50s, and they had no idea that there was ever even a female condom. Going back to what I said earlier, where that was always kind of left to the male partner in a relationship, right? But it's like we need to make sure that we are the ones responsible for our own sexual health,
Eso,
right? So,
eso.
and then what if PrEP is what works best for you? And again, that was a piece where we would first get information. The first information that came out was that PrEP's not for women, right? Guess what? Now it is.
Eso.
But how many women today now may still have that old information, right? Oh, PrEP, yeah, I heard about PrEP, but that's only for men. Only
And
they.
empowering our women, because at the end of the day, that stigma that still exists, right? If you're taking anything, or you have condoms, or you have anything, then
Yeah,
eso. So
exactly.
like really breaking what that conversation looks like internally to empower our women to say, no, this is an ownership. This is a, mire,
It's
yo no tengo tiempo para esto. I'm protecting myself.
self, exactly. Taking care, taking ownership, and empowering yourself on
Eso,
your sexual health.
eso,
Right?
eso. So we could literally talk for hours.
Yes, we
I
can.
so appreciate you, Yusel. We're going to go on to our next IG conversation. Again, thank you. We will talk soon, and definitely join us at our next task force meeting. We hold it every third Friday. We'll have the information in the description, and definitely drop us a line. All right, friends, and we are back. Again, I want to thank GLAAD for this opportunity to take over their Instagram and allow us to uplift not only our community work, but other organizations that we partner with. So we want to continue the conversation that we just had with the Yusel and the Department of Health, as she was talking about the importance of Planning Council. We actually have Whitney Marshall here, which is Planning Council Support Manager. Whitney, welcome.
Thanks, Gabriella. I'm really happy that you invited me to be a part of this opportunity. I think it's really awesome. Um, the whole day is being highlighted for the great work that everyone does.
Yes. So just a little bit of background. So tell me what Planning Council does. I know that I've just been appointed as the chair, which has been super exciting because I'm
Abs-
excited for the changes on a community level. So tell me a little background about Planning Council, kind of like where you started, and we'll kind of base the conversation from there and go from there.
Awesome, yeah. So the Planning Council is a planning body for that advises on like the allocation of funds, federally funded funds from the Ryan White Part A and Part B programs. Um, the and to inform HIV planning where certain funding goes for certain services for people living with HIV, with the ultimate goal of improving the quality of life for individuals with HIV. And as far as like the scope of the Planning Council, it's going to be for the most part Orange, Osceola, Seminole, Brevard, and Lake counties. So we have a pretty large planning body, and there's different planning bodies throughout the state of Florida and throughout the country because Ryan White is a federal program. But I think we have an awesome planning council right now. Like you said, you're the chair. That's great. And doing a stellar job so far. So that's awesome.
I know. Thank you. Thank you. Thank you. So like you mentioned, we support with the allocation of over $11.5 million of funding. And the idea is that we are definitely incorporating the community in these conversations,
Right.
right? So from tabling events to the larger planning body meetings, we're continuing to have the voice within the community. So how do you feel that we can continue uplifting those at risk and living with HIV to be a part of these conversations?
Absolutely. So we're definitely trying to up our recruitment efforts so that we can get more voices at the table that are experiencing and living with HIV. So but just to give you some background on what the requirements are for the planning council, the we're mandated, we're federally mandated to make sure that we have a certain percentage of individuals on the council living with HIV for that the representation purpose. Um, and so far, I don't think the planning council has ever had a problem with that meeting that recommendation standard. Most of the time, it's gone way above it. So I think that's incredible. We also have individuals on the planning council that are very plugged into the community, like yourself, for example. But a lot of individuals on the planning council that are very plugged in the community, that are handing out our flyers constantly, that are telling people to come to the meetings, especially like the Ryan White community meetings, which are specifically targeted for making a safe space for people living with HIV to come receive information about what's going on in the community, and essentially have a meeting just for them.
And I think what's awesome is that not only are we uplifting and highlighting what's going on in the larger meetings, but we're also giving like tidbits of information, whether it's healthcare access or support with food
Right.
stamps, or so it's always a constant conversation with other community members and organizations, which also speaks volumes, because I think we're able to plug in individuals when we hear these needs. We're just able to be like, oh, okay, it's a nutrition need. Let's go and talk to this individual and plug you with this individual.
Yeah.
So you have that soft hand approach, as opposed to being like, okay, we'll deal with this later. It's a
Right.
conversation that happens right then and there. And I
Absolutely.
pride our planning council in being able to do that. And I think the community meetings have definitely been built on being able to have those conversations, and very transparent as well.
Yeah, absolutely. Like you said, usually it can be addressed right there in the room. And with the exception of like a few issues, usually like a representative from an agency will be like, yeah, we can talk about that after the meeting or something like that. But there's still usually that follow-up. Um, and and like you said, like if there's a need for a specific thing, someone can usually answer that question in the room, and it serves as a, because all of our meetings are public and audio recorded, it serves as a starting point for other people to receive that information as well, that might not have been confident or comfortable enough to speak up and ask that question in front of a group of people, because there's still this an enormous and horrible stigma around living with HIV.
So, so thank you for uplifting that, because even in our tabling experiences, I was actually talking to Yasel about that yesterday, is like, what is our messaging and our delivery? And when we're talking to specific populations, what does that look like? Like I was telling her about within the LGBT community, we are somewhat very open and liberal about our sexuality. And it's like throwing condoms at Pride, but when we're talking about being in a Latinx setting, that may not necessarily be the case. It may have to
Right.
be in a discreet paper bag, and really thinking about that messaging as we're delivering it to our community members is important. So
Absolutely.
I think for those that are listening locally as well as national, since GLAAD is a national organization, how do you think we can get more involved, not only on planning council, but in just HIV justice in general?
Right. So obviously anyone can put in an application. We have 2 tiers of membership. So it's going to be full membership and associate membership. There are some restrictions with full membership depending on, like conflicts and things like that. But associate membership is a little bit less involved than full membership, but full members do have voting rights when it comes to certain issues like we were talking about earlier with the reallocation of funds, or the allocation of funds of the Ryan White program. um, but even if someone doesn't want to join the planning council on a membership level, all of our meetings are public. If they wanted to come and participate in the meeting, or especially like the Ryan White community meetings, or leave public comments or get in touch with us so that we can relay that information. We have a public comment form that people can indicate what meeting that they want their concern their concern addressed at, and what that is, and they can do it completely anonymously if they would like, so that their voice can still be heard without potentially, you know, putting themselves in a position where they might not feel comfortable. But as far as on a local level, or like that's kind of on a far as on a local level, as far as like on a national level or a statewide level, there are different planning bodies and planning councils for different areas. And so if you're, like I said, Ryan White's a federal program. If that is something that you're interested in doing, then look up your local HIV prevention planning body, and see how you can join, how you can be involved, attend some meetings, see what it's all about and how you can help. So I think that's how, in the context of planning council, that's how people can get involved on the
So
local and
that's
national
the
level.
first step. Or reach out to us here. We're going to be here
Yeah,
all day.
absolutely.
We'll definitely leave our information. Whitney, could you share some of like our social media tags, websites? Where can we reach each other at?
Awesome. Yeah. So our Instagram is CFHPC, at CFHPC.
Okay.
Our Facebook is at Central Florida HIV Planning Council. And our website is going to be centralfloridahivpc.com. So it's always a combination of something like that. But
we'll make sure
yeah,
to have it in the description.
Absolutely. Thank you. Definitely get in touch with us if you're interested in joining the planning council, or you're interested in getting more information on where you can find out where your geographical location's planning body or planning council is. We can always direct you into the right location so that you can get involved where you're at. But yes, our website is also a really great resource for just kind of learning what the planning council is, how you can get involved, seeing any of our governing documents that we have, such as our bylaws and materials that we use for orientation of new members, and then just all of the committee meeting materials. So we'll always have the most updated materials from the last meeting up on the website, and then the archived minutes and agenda and things like that, just so you kind of see what goes on in the meeting and what we discuss.
We also have like a facts page, right? That
Yes.
it's like a Q&A. So
Yes.
like most frequently asked questions for people to reference as well.
Absolutely. Yeah,
and
it's under our about us page.
Dale, there we go. So I believe we have a couple of events that are coming up. World AIDS Day we have coming up, and there will be a virtual component, as well as if you are here locally, it'll be here. It'll be on November 30th at the amphitheater at Lake Eola, and that'll be from 6 to 8. Let me see. I think I have our flyer here.
Yes.
That was amazing, created by the team. Thank you. So if you can join us, and I do know that there will be a virtual component, so definitely stay tuned to our social media sites and we'll have all that information posted. Whitney mentioned the Ryan White community meeting. We're actually going to be collaborating next month with the LGBTQ Center OUAC with Relax It's Just Art to it'll be our second year that we'll be creating local quilt pieces for World AIDS Day that we'll actually have on display and used during our quilt ceremony. So,
yes. And we'll also be having a presentation from a representative from Janssen on U equals U, which is undetectable equals untransmittable. And I think that'll be a great presentation to kind of raise awareness about like treatment and within the HIV sphere.
yeah, so well, I appreciate you, Whitney. Thank you very much for taking a moment out of your day so we can have this essential conversation, and again, uplifting other organizations that we work with, because reality is that's we only go stronger together, and it's having these conversations, right?
Yeah,
So
absolutely.
I appreciate you.
Thank you so much. I'm very grateful that we had this opportunity.
Yes, have a beautiful day.
You as well.